Numbers show Arizona is in a much better place today than we were a month ago. But now that we're here, ABC 15's Nicole Grigg working to find out, is there a clear plan to keep those numbers low, guiding our state leaders?
We have asked the governor for months for any type of roadmap, what the trigger points are, or what his plan is that's helping him guide his decisions throughout this pandemic. We've never had a straightforward answer. He only says that he's relying on public health and the subject matter experts. Front and center at the beginning of the pandemic was Wendy Smith-Reeve, the state's former emergency management director, now an ABC 15 analyst with over 2 decades of experience in crisis management.
Be very proactive instead of constantly and always being reactive to a situation.
Wendy started a long-term planning group before resigning with the belief that her role was duplicative.
So after you resigned, what happened to that planning group?
That was disbanded very quickly.
Officials with DEMA confirmed there was an informal team assigned to long-term planning in March. But, quote, as the pandemic evolved, the DEMA team members were absorbed into the larger response effort, reassigned due to more immediate needs or have left the agency.
Our strategy is to follow the public health guidelines.
2 weeks ago, we asked the governor, with cases trending down, what's the plan moving forward?
So it's very simple things: wearing a mask, physically distancing, washing your hands, covering your cough. These are the things that we'll continue to do, and like I said, we're going to stay vigilant.
Wendy giving her insight on crisis management, suggesting to use the state emergency response and recovery plan as a guide for that long-term planning group that would follow a structure, including these 6 categories, from community planning, economic, and housing, and bring in experts for each.
What's critical about emergency management is we understand all partners and what they do and how they work together. And so knowing who to call and who can provide the solution to fill the gap really gets you to a proactive place much, much faster.
Along with trying to hear a long-term plan, there's also been a fight for transparency. The state refusing to name long-term care facilities with outbreaks publicly, winning a court case to keep that information private. Now they won't give the names of schools publicly either, citing the same confidentiality concerns. So independent sources now putting together databases of schools across the country to track cases for the public.
The spread of a virus like this can impact everyone. And so there needs to be some transparency, because that also gives you the ability to quell rumors that may be out in the public about how bad a spread could be, or when there's not really a spread that can cause unnecessary panic.
DEMA says it's working to address short and long-term planning with specific partners. However, they did not name a specific work group in place. Meanwhile, the governor's office will not acknowledge any formal group that was formed or disbanded. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.